Sue and I are going to talk about the supporter role. So I'm going to give a little bit of background to that, and then Sue's going to talk about, as a carer, what the experience of being a RACT supporter was like in practice. So I'm going to provide some background on the sort of rationale for the REACT supporters and the supervision of those people, so what support people were offered. And then, as I say, Sue is going to describe the actual realities of that experience and what you've taken away from that. The intention was to work with relatives as REACT supporters from the outset, and that just seemed to make perfect sense. So the intention of REACT is to offer support to people who are carers of people with psychosis and bipolar. And having people who themselves have that lived experience seemed absolutely crucial in them being able to offer believable and accurate support and empathy to people who are themselves going through those experiences. And I think this is something we've sort of discussed over the trial. Another important benefit is the RACT supporters being in that role, I think probably felt less constrained in being able to engage with other carers' frustrations about service limitations, and that seems to be an important part of the role. In terms of the resources for the trial, as Heather was talking about, we had 800 people in the trial, so 400 of those people were in the arm that accessed the full REACT toolkit. And the actual resource in terms of REACT supporters wasn't huge. We had 1.2 whole-time equivalents of REACT supporters. So that's, over the duration of the trial, we had 3 core REACT supporters, and in addition to that, we had 3 other people who were offering kind of backup support, which was actually absolutely crucial in being able to cover things like leave and other forms of absence. So I think one of the reasons it was feasible with that sort of level of resource was, although, as Heather was mentioning, a lot of people access the forum, the actual active users of those were a relatively modest proportion of those 400 people. Had the percentages been higher, obviously we would have needed more. And on reflection, were this to roll out to scale, it would be helpful to have had more resource in terms of REACT supporters so that the management of leave and other absence requirements was more straightforward. So working as a team, we managed to cover all of that, but there were moments when that felt like quite a stretch in practice. I guess one of the things that's crucial here is that the REACT supporters are doing a crucial role within the study, and they're facilitating discussions, engaging in private messaging, offering other people support. So it's important that the supporters themselves have support in sort of dealing with that and dealing with any of the issues that come up. So there's 2 elements that seem important in that. There's obviously peer-to-peer support, because the REACT supporters themselves have between them loads of experience of dealing with these things, and sharing ideas is important, but also making sure that that time is programmed into the working week, so it isn't just something that happens when people have some downtime. We also offered clinical supervision, so I led that. So that was a fortnightly meeting, and we had additional support from another psychologist, Bill Selwood, who was able to cover those meetings when I was not there. And there were a number of areas that it was important to cover. So the key issue was supporter well-being, so how were the supporters themselves feeling, what was going on in their lives that may be impacting on how it was feeling doing that REACT support job. Clinical issues coming up through the site, managing site practicalities, ensuring cover was there throughout the study period, and then flexibility to discuss other issues as required. And I think we did a lot of learning over the course of the trial, and I think one key issue was around the nature of offering text-based support as the key medium for supporting other relatives. So that was obviously, people have a lot fewer cues in terms of visual cues that you would have, or tone cues in face-to-face contact. And REACT supporters got really good at honing messages that really sort of conveyed genuine empathy and support in that forum. There's obviously a tension between, if you've got potentially 400 people, between what you're offering to a given individual and what you're able to offer to people as a whole within the time that's available. And I think there was a lot of discussion and supervision about how best to manage that, I think. Offering support was what React was about, rather than offering specific advice, and working out the best ways of doing that was crucial. And being aware of what it is possible to do remotely was something that we also had a lot of discussion about, because React supporters, as carers, are very, very committed to doing the best they possibly could for the participants, but there was only so much that could be done for each given individual, so actually working out the best ways of doing that was another discussion. So that's the sort of broad context, and I'll hand over to Sue to tell us more about their experiences.
Thank you, Steve. I did, when I started working as a React supporter, I had a little note on the side of my desk which said, please remember we are not a crisis service, because I think one of the things that we naturally brought as people with lived experience was that desire to want to help so much. And so we very much welcomed the working with the team to understand some of the limitations of the process. So I've been working on the React study for 3 years as a peer supporter. I have lived experience of helping 2 close relatives manage their mental health conditions. I'm going to talk about my lived experience and the impact of being a React supporter. And what I'd like to focus on is what goes on behind the role, some of my motivations, the job itself, some of the challenges. And clearly I can't fit 3 years' experience into 4 slides, so if anyone wants to talk to me afterwards, please come and see me over lunch or later on this afternoon. So the job itself was actually very heavily computer-based. It's an online trial. We were there to support relatives, signpost them to some very helpful resources, the modules in the toolkit, and monitor the forum, respond to direct messages. And I just wanted to point out that last line, drawing upon their own experiences and understanding of caring for someone with psychosis or bipolar disorder. I think as Steve touched on, it's not perhaps a simple thing to just draw on your experiences, particularly if you've had some traumatic experiences, which is one of my motivations to get involved in this type of work. So as Steve said, there were 6 of us in total working on the programme, and we had a reflective log where we kind of logged thoughts and feelings and some of the learning. And I pulled this one out because of really the impact of where we were when we started, and it highlights the importance of clinical supervision. At the time, back in April 2017, the React supporter wrote, "The emotional weight of managing this job should not be underestimated. Time is needed to process complex and emotional stories as well as training. I sometimes think I'm expected to be functioning as a clinical psychologist. I do my best with empathy, but understanding how to process disturbing stories and what to do with emotional baggage would be helpful." And we moved on from that, and I think it's important. We had a lot of discussions within the peer team, and I remember Steve saying many times a lot of these things don't have a simple binary answer, and getting accustomed to that and also feeling supported by each other was really very important. So these are some of the things if anyone's here interested in taking React forward, but these were some of the findings that I felt should have really been considered, and some of the learning, really, the lived learning, that you do need a support group, you do need training, you can't just walk in to a research team and use your lived experience, and then a supported adjustment is really important. This type of work isn't for everybody, and it's really important that research teams understand that perhaps it's not going to work for everyone who really wants to do something. Confidentiality of participants is always very key within research studies, and I think what we hadn't fully realised was actually the confidentiality of ourselves as key workers, our confidentiality, the confidentiality of our own stories, and also those of our relatives. So having a place to explore our relationships was very important. Ensuring that everybody who was working as a React supporter had genuine lived experience was very important, so people didn't feel isolated, and there was time when we could spend time together. Flexibility was another big one, and anyone who's worked with carers will probably know that things can change very quickly at the last minute. And it was nice to note that when I was rooting through the reflective log, actually 1 year on, we'd moved quite significantly in terms of how we were doing things. The ability to work 2 out of 3 days remotely over the last few months has made a tangible difference in maintaining my health and well-being. I've been able to support my relatives, keep my energy levels up, less drivings and early morning and more sleep, and also stay in touch with the team and be briefed and supervised. This is a great working structure for carers as the study moves forward. Flexibility is key. There have been other times when I've been glad to leave the house, but the key has to be working in response to need. There are quite a lot of things to consider in terms of the nuances of making a bespoke and responsive resource for other people to use. And I just wanted to lastly touch on the role of acronyms, because anyone who's not been working within the health service or within research, PIC might be a participant information centre. It might also be a psychiatric intensive care unit. So there was a kind of stumbling around of acronyms for some of us for quite a while. So being conscious that actually React supporters, people working in this way, and actually anyone needs to be able to understand these complex systems that that sometimes you think if you're in the health service, this is how it is, this is normal. But actually, everybody's coming to the table in a kind of open, but we want to try and make everyone come to the table in an open and inclusive way. So, what can it feel like? I've got just a couple of points. It can feel confusing, it can feel complex, but we're brought in to provide authenticity and to be a critical friend. So, a couple of warnings really. Warning, we will speak from a personal perspective. It's in our job description, so don't take it personally. And another warning might be that we're oversensitive to being left out. It's likely that this has happened in our experiences with services. There are a myriad of perspectives which make for a strong team, so ensure that your exporters feel included. And that's just an image of some of the unhelpful thinking styles that you might have as a family or as a service user. But I just wanted to say that it's relevant to all of us. Try to think of the bigger picture. Don't jump to conclusions. It's not just about you. So, despite some of the issues and challenges, for me it's been a very worthwhile process. My motivation was actually making a real difference to the lives of others. And I just wanted to finish on this a quote from one of the participants. I will say though that so far React has brought me to tears. I can only describe them with tears of relief. Relief that I am no longer feeling so alone and isolated dealing with my son. And we've got a lot more instances of that kind of feedback, particularly from the forum element. So that kind of made some of the stresses and challenges of the work really worthwhile. And that's our contact details. You see, I've got many hats. Thank you for listening.